There are some St. Thomas modifications wherein there is inclusion of ESR, CRP, newly diagnosed clubbing, splenomegaly, microhematuria as minor criteria. And increase in sensitivity of this infective endocarditis happens by 10% when these St. Thomas modifications are added to it. So these are more appropriate for Indian patients when we add. So when we discuss about infective endocarditis, it's predominantly about the major and minor criteria, clinical manifestation, and appropriate treatment, and certain amount of prophylaxis. So pathologically prone at culture negative endocarditis are, if you see, 21% were classified definite by original Dukes, 32 were definite by modified Dukes, and it increases to 62% were definite by St. Thomas modification. So blood cultures, 3 separate venous punctures during 1 hour period, at least 10 ml of blood before giving antibiotics has to be taken. Adherence to above practice yields positive cultures in more than 90%, which is very important. At least 30% of the prescribed antibiotics before taking culture have been given. So sterile cultures in Western world is around 2.5 to 31%, but in Indian scenario, it is almost half, 50%. So multiple blood cultures are taken before empiric therapy. If not critically ill, 3 blood cultures over 12 to 24 hours period has to be taken. The delay in therapy until diagnosis confirmed can be done, but if not critically ill. If critically ill, 3 blood cultures over 1 hour, and no more than 2 from same puncture has to be taken, and relatively constant bacteremia has to be identified. So in case of culture negative infective endocarditis, special media may be required, like the Brucella, Mycoplasma, Chlamydia, Histoplasma, Legionella, and Bartonella things. And then longer incubation period may be required for Hasek bacteria. Coxella burnetii, Q fever, and Tripoloma vipelli will not grow in cell-free media. There are some advances in microbiological culture yields. So whenever the culture yield is less, we do increase the yield by adding sodium polyethyl or a dedicated adsorbent resin to the blood culture and further diluting it. So atypical fastidious growing organisms are cultured in chocolate agars.